Welcome to Alpha Kappa Alpha Sorority Incorporated, Epsilon Chi Omega Chapter's Dental Health Webinar. Today, we will discuss the topic of heart disease prevention. Does dental health matter? The effects of our oral hygiene on heart health. Our guest speaker will be Dr. Harold Rhodes III. Thank you for joining us.
Good afternoon. I am Sora Shun Rhodes, Gamma Xi Omega chapter in Charleston, South Carolina, and I bring you greetings. It is my honor and pleasure to introduce to you my honeydew, Dr. Harold Maurice Rhodes III, improving lives one smile at a time. Dr. Harold Rhodes III is honored and humbled by the trust and confidence of his patients that his patients have in him. He takes that responsibility very seriously and strives to exceed each patient's expectations with every interaction. Genuine smiles and thanks at the end of a procedure lets him know that he's achieving that goal. Being a dentist allows him to change lives. When he transitions a person out of dental pain, he's helping them return to enjoying life. And when he restores the ability to comfortably and properly chew, that person is more comfortable and healthier. Making each patient's smile even more beautiful allows them to feel better about themselves and happier with their appearance. He loves caring for a diverse group of people from all ages and all walks of life. He is blessed to have the best patients and couldn't ask for a more fulfilling and rewarding career. Dr. Rhodes' Doctor of Dental Surgery was awarded by Howard University College of Dentistry in 1987. Subsequently, he completed a hospital residency at Meharry Hubbard Medical College in 1988. By actively pursuing continuing education through meetings, seminars, and lectures, he consistently ensures that he is current on all aspects of dental care. Dr. Rhodes grew up in Walterboro and now lives in Charleston, South Carolina. While growing up, he enjoyed the outdoors and spending time with his brothers and sisters. Upon graduating dental school and completing his residency, he married his wife, yours truly, Shun Houston Rhodes, who is the ultimate top mom. She currently works in telehealth for MUSC, leading and implementing innovative changes in public health throughout South Carolina, and is adjunct professor for the University of South Carolina's Arnold School of Health Services Policy and Management. He also has two children, a son, that's Harold Maurice Rhodes IV, who graduated with a dual degree in Homeland Security and Emergency Management from Savannah State University, and a daughter with degrees in Evolutionary Anthropology, Global Health, and Biomedical Innovation and Development from Duke University and Georgia Tech. Some of his favorite ways to spend time include exploring art galleries, gardening, fishing, listening to music, and pursuing photography. He is always striving to improve himself spiritually and is an active member in his church, Mount Zion AME in Charleston. So without further ado, it is my honor and pleasure to introduce to you my honeydew, Dr. Harold M. Rhodes III. Thank you.
Shun, thank you very much for that fine introduction. I think you know me better than I know myself. I really appreciate that. Thank you also, the sisters of Epsilon Chi Omega sorority, aka Alpha Kappa Alpha Incorporated. It is certainly a pleasure to come before you this afternoon and to speak on the topic, does dental health matter? The effect of oral hygiene on heart health. let's give you a little bit of background. Again, I practice in Walterboro, South Carolina, with the aid of Dr. Jeffrey Craig Gordine, who's a graduate of Medical University of South Carolina. He and I have been practicing together now for 17 years, going on 18. And I've been practicing in Walterboro now a little over 31 years. And it's certainly a pleasure to live my lifelong dream of treating patients and helping them accomplish their oral needs. So let's talk about what's my major job is. My major job is to educate you. Dossier, doctor, means to teach one. So I do lots of treatment, but I also do a lot of teaching. So I want to get my patients, put them in a place where they can accomplish the majority of their dental needs at home or away from the dental office. And when they fall short, and they return to me so I can, re-educate them, introduce them to the latest and best technologies, and try to cater that treatment to each individual. So as we know, children have 20 teeth. Adults are supposed to have 32 teeth. And so we're trying to do everything we can do to encourage you to maintain all of your teeth and maintain your teeth healthy. So some things that you're going to need to do is you're going to have to brush, you have to floss, you have to see your dentist on a regular basis. We find that some patients need to see the dentist more often than others. The American Dental Association recommends that we see our dental professional at least once a year. Most of my patients have dental visits twice a year. And some of my patients need to see me every 3 months or see their dentist every 3 months. And that is to ensure that we meet their oral needs and keep the oral health healthy so it won't cause problems, particularly on your heart. Now, most of the people I see are healthy, but as you know, we live in South Carolina. I practice along the I-95 corridor. And as you know, along the I-95 corridor, diabetes is prevalent, high blood pressure is prevalent, cardiovascular disease is prevalent, strokes prevalent, and periodontal disease is prevalent. All of these things play into one's socioeconomic background. It also plays into race and ethnicity. We find that along the I-95 corridor, that the majority of people, of African Americans, have diabetes. They suffer from cardiovascular disease. We also find that there's a whole lot of periodontal disease. So lots of these people, when they let's say they're going to have an elective procedure. I don't know if many of you know this, but your dentist, as a part of the team, and the American Dental Association recommends that, and the American Medical Association, we work together as a team. So your medical doctor, your dentist, and all your specialty physicians, all of us have to work together. So if one presents him or herself to the dentist or anything that's associated with surgeries, such as cardiac surgery in particular, since that's the subject we're talking about tonight, one would come in, your dentist would take a full set of x-rays. He would do comprehensive oral exam, so extraoral outside of the mouth and intraoral. We palpate to see if there are any abnormalities. We would do what's called charting, and that's where we take measurements in the gingiva or gums along each of the teeth that the patient has in the mouth. And we're looking for the consistency of the gingiva or the gums. We look for the depth of pocket to see if this person, a patient has periodontal disease. We look for, excuse me, oozing of exudate or pus or blood. We question the patient whether or not you have bleeding on brushing or bleeding on flossing, which would be a sign of inflammation. And all these things are noted. And any type of restorations that need to be replaced or restored, we try to do that prior to surgery. So we try to get the patient in as best health as possible to undergo this procedure. Now, cardiovascular diseases, it's been noted that one with cardiovascular disease, the causative bacteria that's in your mouth and that causative bacteria, 4 of them have been found in heart vessels as well. So let's talk about the heart. So that the vessels that's supplying the heart, and these vessels should always be healthy, because if they are not healthy, they restrict the blood flow if they have plaques, and those plaques are considered atherosclerosis. And some of these plaques will break away, and they will cause what's called a thrombus. Okay, so this thrombus breaks away, and it's a causative agent to obstruct or block these vessels going to the heart. Now, if these vessels are blocked, the vessels are blocked, the ones supplying the heart with oxygen, it causes ischemia. And so what ischemia is, it cuts the blood flow. And cutting the blood flow, it could push one into a heart attack if that happens at the heart and around the heart. And if it happens, these plaques break away and get into carotid artery and head to the brain, then that's a cerebrovascular ischemic event, and that event would lead one into a stroke. So it's very important that one would consider maintaining proper oral care to facilitate a healthy heart and prevent stroke as well. Let's see what else we want to talk about here. Cardiovascular disease affects over 1,400,000. There are over 1,400,000 deaths in the U.S. annually, secondary to or primary to cardiovascular disease. Periodontal disease, on the other hand, affects 47.1% of the adults in America. So as you see, almost 50% of the adult population in America suffers from periodontal disease. And again, Streptococcus sanguis and T. gingivalis are 2 of the causative organizations that they found in these vessels around the heart, and also in the atherosclerotic plaques. So there is an association, and there's concern that good oral health is directly correlated to heart health. So that's very important. So to answer that question, does dental health matter? Dental health matters significantly. Smoking, as we know, smoking will cause gum disease, but smoking also affects and it plays into cardiovascular disease as well. And healthy lifestyles are important. So if one's smoking all the time, chances are that person isn't living a healthy lifestyle. Not 100%, but chances are that person is not living a very healthy lifestyle as well. So that will affect cardiovascular health as well. Okay, so I know I'm jumping around all over the place here, but let's get back to the nidus, or the start of this, with periodontal health. Now, I will say this, that most of the studies have found that when one suffers a stroke, there's a very good chance that they also suffer from periodontal disease. And if one is experiencing a cardiovascular accident or a heart attack, okay, there are good chances that this person also has periodontal disease. Okay, so again, there is an association. So, but what do we look for? So in periodontal disease, again, we look at the texture of the gums, and if The gums are spongy and doesn't have an orange peel-like appearance, and that's called stippling. If one suffers from, prolonged halitosis or bad breath, that's also a sign of periodontal disease. Teeth that look elongated due to gingival recession, that would be a sign. Loosening of teeth would be a sign. And also loose teeth. And when one masticates or chews, that would also cause some of these bacteria to enter the circulatory system and lead to some untoward cardiovascular accidents and cerebral vascular accidents as well. Most of us, even after you brush your teeth, one's teeth, you're going to have gingivitis. So you're going to have some bleeding. This gingivitis is caused by the bacteria film, plaque, or pellicle, as it's called in dentistry. And so almost, 15 or more minutes after you brush your teeth, this plaque begins to form. So our job is to keep this plaque at a minimum. But if the plaque accumulates and you get this tartar buildup, this buildup, again, will cause the teeth to separate. If it's not removed, it will cause the teeth to rotate. It will throw your occlusion off. It will cause teeth to become protrusive. So, and I know, a lot of people say, well, I don't need to go to the dentist to have this plaque taken off. I can just go to the store, get a real good toothbrush, and I can scrape it off myself. But it doesn't work that way. Because, again, to have periodontal disease, one must have bone loss. Okay, you must have bone loss, and also the destruction of the periodontal ligament fibers. And this buildup I'm talking about, it destroys the fiber around the tooth, and it continues to push the gums away. And so we would have to anesthetize you. And I don't want to get too graphic, but you have to be numb so we can get down. And it's called, and most of you probably heard the term subgingival scaling and root planing. That's not a regular cleaning. Okay, subgingival scaling and root planing is scraping all of this toxic material off of the root surfaces, and so we can try to get the attachments and the gingival or gums around that tooth healthy again. But in doing so, some patients who are compromised with strokes or cardiovascular diseases will have to be placed on antibiotics before the procedure is done. So again, it becomes multidisciplinary, because I don't recommend an antibiotic. I would contact your cardiologist, and he and I, along with your physician, will determine what is the best antibiotic in your case to treat your condition. So as I said, again, it's multidisciplinary, but again, the masticating, chewing, and the cleaning or subgingival scaling and root planing will also cause an introduction of these bacteria into your circulatory system, which could cause an untoward effect. And so that's why we want to put the patient on antibiotics. And so again, one can have mild gingivitis, gingivitis, mild periodontitis, moderate periodontitis, and severe. There's one type of periodontitis that's not written about in the literature. When I was at Howard, I got an overabundance of education on juvenile periodontitis. And sometimes I've seen it go misdiagnosed, but typically you would see this in African-American females, 16 years and older. And basically it always affects the lower first molars in the mandible, the lower jaw, and the anterior incisors in the lower jaw as well, and the upper first molars in the maxillary. So again, periodontitis comes in all different forms. Um, you want to maintain a very close relationship with your dental professional. As a matter of fact, I have patients who, and also I neglected to say that actually brushing your teeth will also cause an untoward effect as well, because it introduces these bacteria into your circulatory system. But I try to cater my treatment to patients. Patients come in and said, "Oh, I went to X drugstore or picked up a toothbrush, and I don't recommend that. Okay, I recommend to all my patients that you see your dentist who knows your mouth, and we recommend what brush is best for you. Okay, and it's always going to be a soft bristle toothbrush with the ADA sign of approval on it. Okay, some patients are recommended to use wax floss. Others we recommend unwaxed floss. So again, if you have a relationship with your professional, healthcare professional, we all would recommend what's specific to you. It's just like you going into the beauty salon, and your hairdresser knows what you like and your style and all. Before you get there, everybody's on the same page. And so this is what we like. So we ask all patients. I ask all patients at all appointments to bring all of their medications with them, all of their medications, because when someone's uncomfortable, all they want to do is have a tooth extract. Okay, and it doesn't work that way. Okay, so we have to be extremely careful. Again, the dentists are first line, because most patients will see their dentist much more often than they're going to see the medical doctor. I would say a good 25% of my patients that have appointments do not get treated for what they came in for. Number one, blood pressure extremely too high. Again, I haven't taken my medicine in 2 months. I've had patients that have presented with blood pressure so high, they were delirious. Okay, and I'd say, hey, call the next of kin, which we have that in the record, and you take this person, you take your loved one to the hospital and have them examined. And unfortunately, a couple of them had to be admitted. So you don't want, and again, patients, all they want is their work done. If someone's taking bisphosphonates, again, you don't want to do extractions on this person. Okay, if when we check the pulse, and again, periodontal disease causing problems for with cardiovascular disease. One of the signs and symptoms of cardiovascular disease would be, of course, I want to say Sister Barnes, but Ms. Barnes, that these plaques and atherosclerosis sometimes will cause arrhythmias, bradycardia, tachycardia. So we see a pulse that's under 60 beats per minute, or see one that's in excess of 100 beats per minute. That's cause for me to stop and say, we need to back up. I can give you some analgesics, I can give you some antibiotics, but you need to go see your medical professional. So, it's very comprehensive, and the older I get and the more I practice, I'm beginning to have appreciation for total body health. If someone, and I tell patients all the time, if you're taking medications for a cut on your toe, that's of concern to me. You got a cut on your toe, it hadn't went away. I mean, this could be, even though you hadn't been diagnosed, this could be a sign that you headed into diabetes or something like that. So again, it's a total body approach. Again, dental health does matter. And in leaving and closing, I would say that everyone should have a very good relationship with their dental professional, because everything about you matters. Everything about you matters. And I always like to take a holistic approach when it comes to rendering treatment to my patients. So again, thank you all for having me. I hope I was able to impart some knowledgeable facts in regards to oral health and cardiac health on this forum this evening. And please reach out to me again. I'm willing to do some work off the farm as well. But again, thanks for having me, and have a good evening. Thank you.
Thank you to Dr. Rhodes III and to his lovely wife, our sister, Mrs. Shawn Rhodes, for participating in our heart health prevention webinar, asking, does dental health matter? In regards to our oral hygiene and its effects on our heart, yes, it does. We hope that you enjoyed the webinar and it was informative to you, and that you will join us again. Thank you so very much.